Thank you, Mr. Chairman and Ranking Member, and thank you, Dr. Hahn. It was good to meet with you. I'm impressed by your credentials and experience. Your comment a moment ago that you have respect for Congress calls into question your judgment, but nonetheless, the great balance that you will have is to fulfill your responsibility at the FDA, where public health is of the ultimate significance, versus the strength of politics and political donations, which have an enormous impact on the decisions that sometimes are made in Washington. And the stress that can come from politics and people who are driven by politics or political donations is wholly different than anything you've ever experienced in life, and I can attest that myself. And so this issue of vaping, as it relates to this question as to whether you will put science and public health ahead of politics and political contributions, and they don't come to you directly, but they come to people who will be telling you what to do. The question is how you will balance those things and which you put forward. For me, this is vaping is, if you will, the canary in the coal mine, or better, the child in the vaping room. And so how you will deal with this issue is a pretty good test case for how you would deal with this issue on an ongoing basis on matters not just relating to vaping. I mean, in September, President Trump and Secretary Azar said they'd regulate flavored e-cigarettes. We now know that over 5 million high schoolers are addicted to nicotine through vaping products. The members of this body have been waiting for more than 2 months for the FDA to release a flavor ban. And while we've been waiting, 35 more people have died from lung injury. And I understand these deaths may be from adulterated products, but you can't decouple this from the fact that flavors are what's luring kids in. Just 3 days after this committee heard from the FDA and CDC officials that flavored e-cigarettes are driving youth vaping rates, we learned from news reports that the administration may no longer act on banning flavors. A number of us have bills that relate to banning these products, banning flavors. Some include menthol, some don't. Some have a sunset provision, some don't. But this is a really critical issue. And the first question I'd ask you is, is the FDA and your leadership able and willing to take action which will protect our kids, whether or not the White House wants you to take that action?
Senator, thank you for the question. You know, as a physician, I took a pledge many years ago to uphold the ethics of medical practice and to always put the patient first. Senator, I take that pledge very seriously, and I think if you ask anyone who's worked with me, they'll tell you that I have upheld that pledge every time I've seen a patient, but also as a medical executive and a leader of academic medicine. I take that incredibly seriously. Patients need to come first, and the decisions that we make need to be guided by science and data congruent with the law.
There are many people who rely upon that oath, and I have as a patient, and I certainly hope that that will be foremost in your mind, because this is a place where sometimes an oath of that nature takes a back seat. I would note that Dr. Schuchat last week in her testimony indicated that flavors are the key driver in leading us into this youth vaping epidemic, where we have millions of high schoolers and middle schoolers that are now addicted to nicotine and will be battling with that throughout the rest of their life. I can't imagine a reason for holding off on immediately banning these kinds of flavors. Do you see a reason for holding off on that?
Senator, I've also seen the data that you described suggesting that flavors are a significant positive effect, not positive, but an effect for children using e-cigarettes, and I am alarmed by those data, completely alarmed. I think it's a serious issue, and I think it requires bold action to keep these out of the hands of kids. Do not want to see another generation of children become addicted to tobacco and nicotine.
You recognize, of course, that there will be very strong lobbying efforts on the part of tobacco producers, tobacco companies, vaping shop owners, vaping shop employees, a lot of jobs on the line. There'll be enormous political pressure, which will say, keep these products out there. And there's not a lot of money coming in the other side. From a political standpoint, there's no one coming to us and saying, hey, we're going to contribute to you all if you'll make sure and ban these flavors. No, it's just moms and dads and millions of kids that need, basically, it's going to be on your shoulders. As I understand it, you're the decider here. You're, as President Bush used to say, you're the decider. Are you willing, and is there anything that's keeping you from making that decision to ban these flavored products?
Senator, as I mentioned to Senator Murray, I understand that the final compliance policy is under consideration. I don't want to prejudge that, and I don't have all the facts that they might have, but I can tell you this for sure, sir. I will use science and data to guide the decisions if I'm fortunate enough to be confirmed, and I won't back away from that. I'm a lung cancer doctor. I'm a researcher. I'm a father, and soon to be a grandfather, and I take that incredibly seriously.
Thank you.